And we're back on Morning Barbados for this Monday, the second day of June. And of course, as we have been in recent weeks, we have been getting into my skin, or your skin for that matter. Dr. Andrew Forde, dermatologist, is with us again. And today the subject is going to be psoriasis versus, what's that word? Liver spot?
Versicolor.
No, it's Pityriasis Versicolor, Doug.
I hear you.
You knew that,
Yeah,
right?
these are,
Gesundheit.
in medicine we use a lot of big words. I guess
Well, the
there's a
technical
good
terms,
reason for
I
that.
understand that. But
Yes, Pityriasis Versicolor is a term which describes dryness on the skin of various colors. And for the average Barbadian, it's called liver spots, and for Trinidadians, it's called lota. It is a condition that's caused by a simple yeast that lives on the skin called Pityrosporum orbiculare. And this yeast is normally there and lives in harmony with us, but in some individuals who are very active, who live in high humidity conditions, the yeast becomes overgrown. That's when you start to see manifestations on the skin. These manifestations, as I said, are flat, dry areas, and they can sometimes be red initially, but usually it's either a lighter color than the normal skin color or darker. It occurs mostly on the trunk, which is the chest and back. But when it's in an area that's protected from the sun, it's usually darker, while in an area where you get sunlight, it's lighter, and that's because of some carboxylic acids that are produced by the organism, and also it's a physical block, just like when you're wearing your watch and you take it off after a few weeks, you
you see
realize
the
the skin
tan.
is lighter under there. So even though it occurs mostly on the upper body, it also occurs on the face, especially here, and it's a common skin condition. It is treated with antifungals, either types that you rub on, or you can take antifungals to get rid of it if it's very profuse.
Okay.
But it can be a recurrent condition, and
that's what
here
I
it's
was
very,
gonna
very
ask you
common.
about, yeah, because I've had some spots and you treat them and they disappear, and then all of a sudden they come back
Back.
years later. Yeah.
Yes, this is extremely common in places in the world where you have seasonal conditions, but in Barbados where it's always hot, especially if you're always working out and doing things that make you sweat. If you're someone who grows a lot of the yeast, then you can have many recurrences of it. I guess the important thing for people here is the tenuous connection with drinks and acids and that sort of
Yeah.
thing. But that's not really a cause. Some people just grow the organism more than others.
I was going to ask you about that because people always say that it has to do with drinking too many soft drinks and that kind of thing. So is it anything else that predisposes you besides the weather factors and the sweating?
Well, I guess organisms grow where the conditions are best, and in some individuals conditions are better than others, and we have perfect weather here for this sort of thing.
Okay. What else can you share with us about that? And how do we keep it away if it does happen? Doug talked about his recurring. How do we keep it away?
Yeah, well, there are various ways you can do that. Simple washing of the skin with shampoo-like applications which get rid of dryness, like selenium sulfide containing things that are used for dandruff.
Right.
In other individuals who have it more often, they may take some oral antifungal at intervals, even sometimes monthly intervals or weekly intervals, or for the knowledgeable patient, they just keep the medication, and when it starts to recur, they will take it or apply it.
Okay.
I used to use Selsun Blue shampoo.
Yeah, well, that's another one of these peeling agents, and antifungal creams are very common. The difference between a cream and an oral treatment is that when you use a cream, you have to use it for at least 3 weeks and touch all the areas, but if you miss out some areas, then it will just grow back quickly.
Okay, so shampoos and maybe the tablet are your best options. All right, so that hopefully that will help you, because some people can really be affected by this, and I'm sure it makes them fairly self-conscious. But what you've said, there is hope, and it can go away. It can be controlled.
Yes, definitely. It's one of the easier things for the doctor to treat,
Okay.
for sure. We did have some pictures. I'm not sure if we'll get them this time. But there are a few conditions that have the same first name, pityriasis, which means dryness, as I said initially. Another common one is called Pityriasis rosea. This is a different type of condition that presents as little bumps and also flat round areas on the body. It affects a lot of young people, but what's significant about it is that it starts with one single oval ringworm-like dry area, which is called a harrow patch. And that stays on the skin for 1 to 2 weeks. And most people think it's what we would call a ringworm or a fungal infection or dermatophyte infection. But then over a period of about 2 weeks, you start getting between tens to hundreds or thousands of these little bumps or circles on the body. You feel well, but all of them are, as I said, little oval shapes or elliptical shapes with dry edges, and it can become quite profuse. Every time you look in the mirror, there's a new one, and it can be quite disturbing. But the good thing about it is that it's not contagious. You usually get it once, or if you're unlucky, you may have a recurrence. There is some link between having it and a viral infection of some sort. So most people may be under the weather a few weeks before, but it's something that goes away. It leaves lots of marks initially, but in a few weeks the skin is perfect again.
So it doesn't scar?
No, the doctor just has to treat the symptoms, which may be sometimes itching, and sometimes a topical steroid cream can help as well. Another pityriasis condition is one that's called pityriasis alba, but the alba part means a lightening of the skin, and that occurs that occurs in lots of young children. It's a kind of a chronic light dry areas on the face, and even though it's a type of eczema, sometimes it doesn't respond like other eczemas do, so people can have it over a period of years, but everyone gets better. And again, that's something that you just treat the symptoms. But the discoloration, any discoloration of the skin is usually very concerning for patients and their families.
I wanted to ask you though, Dr. Forde, are there any real challenges with home remedies with these kind of ailments? Because everybody has a solution to some of these problems, and it's worse now with technology where you can go on the internet and diagnose yourself. Are there any real challenges in applying the wrong treatment for these?
Well, there are home remedies that work, and historically we've seen that that's the case. The difficulty with the untrained person is coming to the right conclusion. Of course, half of the battle is making the diagnosis, and if you are on the wrong track, the thing that you think will work may not work, and sometimes it may hurt. So unless you're an individual who's had something several times and you've been told what it is and you get to know how it behaves, how it looks, then that knowledgeable individual can use these home remedies effectively. But for the person who's having it for the first time and trying to decide what it is, I wouldn't really encourage that at all.
Is there anything that you can eat more of to help with these
pityriasis conditions?
Pityriasis conditions.
Well, no, diet isn't really a big part of it. But as we know, once you're eating healthy and having a healthy body, it is important for the skin and the hair and the nails generally. So by doing healthy things, you can be as fit and healthy as you can possibly be.
You talked earlier about the ingestion of acidic items.
And foods.
You know, what should you stay away from?
Well, generally you should try to have a healthy diet. These pityriasis conditions aren't really related to diet at all. So as I said, you don't really have to do anything specific. It all depends on your family history, and your weight and your age. If you're a healthy person, a fast metabolic rate, you can get away with eating things you shouldn't. But as we get older and we slow down, then it becomes important to keep our body weight down.
Now, this is another quick thing. Maybe we could start this conversation today in the final minute we have. Growing flesh or keloids, is that common here in Barbados?
Well, keloids are very common in Barbados. It's usually a response to a foreign body reaction or some sort of trauma, or even a scalpel incision. In the individual who is very prone to it, it happens commonly in the middle of the chest or along the sides of the face, or any place that you get a wound or an incision. The skin thickens and it starts to itch, and sometimes it can be painful, it can be constricting, and it can pull the skin. And also it happens in the ears a lot for people who pierce the ears. As far as the ears are concerned, that's one of the most gratifying surgeries you can do, excising them from the ears. On the body, steroid injections are still the best treatment that I have found.
And they work.
Of course, it gets them to flatten, but there's associated discoloration of the skin. The surface is never completely the same, but at least it can be flat, and that can get rid of the symptoms. But there are many other modalities that have been tried, from lasers to x-rays to excisions. But the thing with an excision is that if you get a keloid removed, you have to watch the excision scar very closely, because that can form a keloid, which can be bigger and more
Wow.
troublesome than the original. So the problem is that some people get it done, and maybe the doctor doesn't communicate well enough that they should have review visits to make sure it doesn't thicken.
Monitor
and
it.
years would go by, and then they present with a larger scar than the one that they had. So if you can monitor it properly, then you get a very good result. But usually on the ears, when you remove them, that's a one-off treatment,
lovely.
providing you get everything, all of the thickened areas out.
That's good news. That's absolutely good news. Huh? So there you
Particularly
go.
for big-eared people.
Whatever. All right. Well, thank you very much, Dr. Andrew Forde, for sharing with us. I hope he's answered some of your dermatology questions. We'll talk with him again on Monday. So stay with us. Of course, this week we're observing World Environment Day, and for the whole month of June, you'll be hearing featured things regarding the environment that we can take